Okay, last but certainly not least, my colleague Dave Renaud from Population Medicine at OVC. To bracket, we began this morning with calf nutrition and dairy beef optimization of growth and management for both dairy and dairy beef calves. And to sort of close those brackets, I've asked Dave to talk about some of the research from he and his team, more on the therapeutic side of treating calves that get sick. Over to you.
All right, thanks, Stephen. It's nice to see Mike still at the back, so thanks for sticking around, Mike, for this presentation. This is what it looks like when you don't collaborate with Mike Steele, actually. So I know he had a thing with number 6, I think, on the list, right, Mike, about collaborating with Dave Renaud. Well, this is what it looks like when you don't collaborate with Dr. Mike Steele. So, thanks for the laughter. It's good. Laughter's good, right? Especially the last presentation. Okay, so why do we focus on calf diarrhea? Why is it important that we consider it? And thanks to Mike for leaving the room. Diarrhea remains really the most common cause of morbidity that we see in calves. And in the research that we've done, when we look at and actually screen the calves for diarrhea, do fecal consistency scoring, we find that 65 to 85% of calves have at least one day with diarrhea. A massive number when you really think about it. We also know that there's tremendous long and short-term and long-term impacts. So if we look at the short-term impacts with this calf here, calves that have diarrhea have a 2 times higher rate of mortality. They have a 1.7 times higher rate of respiratory disease, and they reduce growth. If we follow these calves out to their lactation, those impacts really remain with those animals. So we'd lose about 325 kilograms of milk production, and those animals are actually more likely to be culled even once they reach their first lactation. So if we think about those impacts, it's cumulatively a lot. And we've estimated that the impact for the average Canadian dairy farm is roughly about $28,000 a year. If you want to know where we made that up, here's a dashboard, a link to the dashboard. I don't know if you can scan your QR code on that on the bottom. But one of my postdocs, Curtis Sobowaychik, I think I said that name right, Hannah. No, I didn't, totally butchered it. Anyways, he made that dashboard for us, and I encourage you to check it out. It's interesting to look at and play around with the numbers. So when we think about this and we think about the impact, we really want to think about how do we prevent it from happening. Really, that's where our first starting point is. And I talked about this actually last time at the Dairy Guelph seminar 2 years ago when I presented. We want to focus on colostrum. I'm sure Mike talked a lot about that this morning, the importance of colostrum management. We also want to make sure that we're feeding these calves extremely well. We want to make sure that we're putting them into a clean and dry environment. But we also want to make sure that we're treating these calves appropriately. It's really, really important, especially when we consider that if we have a sick calf, for every 100 calves that get sick with diarrhea, between 5 to 29 of those calves end up dying. So we really need to provide prompt treatment and appropriate treatment to these animals to hopefully reduce the severity of this disease and reduce the incidence of them actually getting it. A question that's often asked, or that I often get asked, is does the therapy depend on the pathogen that they get infected with? So maybe show of hands, do you think the pathogen, whether it's coronavirus, rotavirus, cryptosporidium, do you think that matters with calves that have diarrhea? Okay, some hands, some nods. So you have these pathogens, they come into the calf, my fancy animation, look at that, it's so cool. Shortens the villi, and then we have our impact. So what we did in this study, one of my current master's students, Olivia Gibson, is looking at this, is we sampled calves right at the onset of diarrhea, and we look for the main pathogens that are responsible for causing diarrhea. So Cryptosporidium parvum, coronavirus, rotavirus, and also we looked at Salmonella as well through culture. And what we found was actually it didn't necessarily matter for the majority of diarrhea-causing pathogens. So the rate or resolution of diarrhea, which is what this graph is showing you, I don't know if I can use this laser pointer here, is that showing up? So we have 100% of calves that had diarrhea at the beginning, and you can look at the days to resolution on the bottom. So every time it drops down an inch, that's a calf that's resolved that bout of diarrhea. And what you can probably see with coronavirus, cryptosporidium, and rotavirus is that resolution happens at the same rate. When we also look at their clinical signs, it also occurs at the same rate. For Salmonella, it takes a little bit longer, but it wasn't statistically significant. It wasn't different. So the takeaway message is that if you have calves that are dealing with diarrhea, just treat them the same. You don't have to have a special treatment just because they're infected with one of these pathogens. In addition, what Olivia also looked at was she also looked at the number of pathogens that they're infected with. And similarly, no differences, even if they're infected with 1 versus 3 pathogens. So we can treat all the calves the exact same. So if we see a calf that looks like this, and I'm sure many of you have maybe seen a calf that looks like this, what do you think are the number one thing that we want to consider? What should we give to this calf right away? Fluid. We really need to give this calf fluid because they're losing a lot of fluid every single day they have diarrhea. And actually, one of Mike Steele's former PhD students, Juliet Wilms, we're working with her on this study. She actually measured how much fluid these calves are losing. And from a very kind of unpractical perspective, they're losing about 38 grams of fluid per kilo of body weight per day. And if we look at it on an average of a 40 kilogram calf, they're losing about 1.5 liters every single day, 45 kilogram calf about 1.7, and 50 kilogram calf about 2 liters of fluid. So clearly we want to replenish the fluid that's being lost. That's really, really critical, and we can reduce mortality quite substantially if we do that. So if we think about it from a practical perspective, what should we do? We have a calf with diarrhea, that calf appears standing and strong. Well, the simple solution is we give that calf oral electrolytes, ideally once per day, 2 liters once per day should be enough. But there are some challenges with the electrolytes that are available in the market. Currently, if you look at the Ontario context, there's about 20 different electrolytes that are available for calves. And you ideally hope that they don't cause harm. But in some cases, that may not be true. And that's also another cool study that Juliet did, where she looked at an electrolyte that was hypertonic, meaning it had really high osmotic pressure. And then she looked at a control group that was just fed mostly water, and then looked at the differences in time to resolution between the two groups. So this is what it looked like on the control group. All the calves have resolved their bout of diarrhea by 6 days after its onset. If we look at this hypertonic oral electrolyte solution, it actually took much longer for these calves to recover from the bout of diarrhea. The diarrhea actually went on for long periods of time in some of these calves. So clearly, the electrolyte actually does matter. And there are some electrolytes that are on the market that probably do cause harm. And when we think about what's happening here, if we feed this calf the electrolyte, which is what the pink is showing, what's happening is there's so much osmotic pressure that there's actually fluid that's probably being pulled into the lumen of the gut, perhaps making diarrhea worse. So there are some pretty big question marks about what is the optimal electrolyte that we should be using for calf diarrhea. In addition, there's also questions about the level of sodium, the level of potassium and chloride. Those are lost in pretty high amounts when we look at calf diarrhea. And we also have question marks around the timing of when they actually need to receive electrolytes. So there's a lot of question marks about that, and hopefully we'll be able to answer that in the next few years. So back to this, what do we do next? We have a calf that's weak. It's greater than 8% dehydrated. How do we tell that? We look at their eyes, their eye recession. The level of dehydration is really highly correlated with the amount that their eyes are recessed into their head. It can be a fairly practical indicator to tell you that that calf actually needs IV fluids to recover. So give that calf IV fluids. Also, if you have a calf that's unable to stand, we also need to provide that calf IV fluids. Unfortunately, for a lot of calves that are unable to stand, they don't necessarily get that prompt treatment because often we might give up on that calf. We don't think that it's going to respond and we don't think that it's going to recover. So here's just an example of a calf. One night I was on call with our clinic, ruminant field service, called out to one of our clients and saw a calf that looked like this. So totally down and out, cold ears, couldn't stand, poor suckle reflex. This is what it looked like after I put IV fluids in it after 5 minutes. Sitting up, this is what it looked like after 15 minutes. It's really impressive the response that you can get when you give these calf IV fluids. So from a producer perspective, we don't want to give up on these calves. We want to continue to give these calf fluids to hopefully get them to recover. All right, what's the next thing we want to consider? So we've talked about fluids. What else do we want to consider? It's a big room to play this guessing game, but we're going to do it anyway. What's the next thing we want to consider? Potentially anti-inflammatories. There's a lot of inflammation that happens in the intestine when calves have diarrhea. There's also a lot of pain that's associated with it. You can talk to maybe some of our vet students like cryptosporidium parvum. It is quite painful to get this condition. So there's pretty good evidence to suggest that we should give non-steroidal anti-inflammatories right at the onset of diarrhea. And in these studies that have been done, one was done in Guelph 15 years ago or so, they found pretty big improvements when you give meloxicam, in this case, to calves at the onset of diarrhea. So they found that the calves resolve faster. They also improve their ability to consume grain, water, many of the other components. And in some cases, they found that they actually have a reduction in the level of antibiotic use in those animals as well. So using anti-inflammatory can certainly help. I'll spare you from the guessing game for this one. But the last consideration is antibiotics. It really should be a last resort, one that we don't give every calf with diarrhea an antibiotic. The reason that we do need to give it to some calves is what's happening when calves have diarrhea is they actually have some bacteria that's passing through the small intestine into the blood system. So we do have some bacteria that's moving in there, typically E. coli if we look at it. And we've also found in our group, this is a study by Louisa Zacchia, who's a PhD student of mine, we also found that calves that have diarrhea have a more permeable gut. So meaning that there's more bacteria that's able to pass through to the blood system. So if we think about, from a practical perspective, who needs antibiotics, it's very few cases of diarrhea that truly need it. So only about 30% roughly of calves have bacteremia, meaning they have bacteria in their bloodstream that necessitates antibiotic treatment. If we look at the main signs that we can use to judge whether a calf is bacteremic or not, it's quite simple. We can see if that calf is bright and alert, doesn't need antibiotics. A very low proportion of those calves actually have bacteremia, only about 6%. If we have calves that have dull or marked depression, typically those calves require antibiotics because 71% of those calves have bacteria in their bloodstream that necessitates antibiotic therapy. Fever, a bit of an unknown, only 24%, and blood in the stool, also a bit unknown as to whether or not calves with that need antibiotics. Largely, a lot of this in the past has been based on expert opinion, telling us that we should or should use this flowchart, we should base our antibiotic treatments on it, and no one's really evaluated what we should do in terms of when we should provide antibiotics to calves. So what my current PhD student, Louisa, is working on is really using a selective algorithm to treat calves with diarrhea with antibiotics. So what we did in this case was we enrolled 108 calves right at the onset of diarrhea at a calf rearing facility. So really high disease challenge, really high disease burden. And what we did was we assigned the calves into two different groups. They either received antibiotics right at the onset of diarrhea, so 100% of them received a treatment with antibiotics, or we used a selective approach that we built based on a study Louisa did, but also other previous studies. So they had to have 2 or more signs to be treated with antibiotics. The signs we used were scleral injection, so it means like kind of injection of the veins or blood vessels around the eye, fever, unable to stand, sunken eyes, and also no suckle reflex. And the reason that we use those is often they're correlated with dullness or depression or dehydration. And we found that calves that are more dehydrated typically have higher levels of bacteremia. So then what she did is we looked at the level of antibiotic use. Obviously our group at the top, 100% received antibiotics, so that's good. Our treatment groups actually worked. And in the bottom group, we found 37% received antibiotics. This is probably a little bit higher than what I'd expect if we did it at a dairy farm, to be honest, because we had pretty high disease pressure, pretty high disease burden in this case. So if we looked at the results, first one being mortality, we actually found that calves that were on that evidence-based algorithm, so that selective therapy, actually had lower rates of mortality. So if you kind of scroll down to the end of our experiment at 90 days, about 5% died in our evidence-based group, whereas in our control group, it was closer to about 20% of calves that died. In addition, when we looked at rescue therapy, which is receiving an antibiotic treatment or an additional antibiotic treatment, we found the evidence-based group is about 5%. In our control group, which received all antibiotics at the onset, is about 20%. So about 16 percentage point higher risk of them receiving a rescue therapy with antibiotics. And then if we looked at respiratory disease, we actually found a difference here as well. So the evidence-based algorithm group, about 2 days with respiratory disease, and the control group had about 4 days with respiratory disease, so an elevation of about 2 more days. So clearly, if we're giving antibiotics to animals, there is a consequence, especially if we're not giving it at the right time. So we need to be really smart and strategic about when we're providing antibiotics to ensure we're doing it at the right time. The other important thing to consider is to ensure that we're providing the calves with the correct dose. If we're not providing the correct dose, we're underdosing or overdosing, there's a potential risk there with treating these calves. So this is actually a summer student project. Zara Churon, who's a master or a DVM student, worked for me this past summer, and this was actually a project that she came up with herself. So in this case, what she did was she visited 16 dairy farms locally here around the Guelph area, and then she had a conversation with the producers. Specifically, she asked them what drugs are they using to treat diarrhea, what drugs are they using to treat respiratory disease. Then she asked them what dose would they use to treat that calf for respiratory disease or diarrhea. And we evaluated 5 randomly selected calves for each disease, so 10 in total. And then what we did was we actually weighed those calves, and we calculated what is the correct dose that we should provide to these animals. So we look at calf diarrhea, and we look at the percent difference or the calculated difference between the two. We found that on average, producers are using about 30% more than what is on label or what is the recommended dose. If we look at those that are overdosing, about 57% of those overdosed by more than 10%, and 19% underdosed by more than 10%. If we looked at respiratory disease, on average, the dose that they provided was 19% higher than it needed to be. We had 44% that overdosed and 32% that underdosed. So clearly, I think there's a little bit of work that we can do here to ensure that we're providing the right dose for these animals. So how do we do that, and how do we do it practically? Well, we could go out and we could weigh every single calf, but practically, I've worked with enough farmers and veterinarians myself to say this probably isn't going to work. But potentially what we could use is we could use a weigh tape. A weigh tape is something practical, something small that we can bring to individual calves that can really help us determine the correct dose. If I was presenting this to you 2 years ago, I probably would have told you actually weigh tapes suck and we shouldn't use them. And we actually did a study to prove that weigh tapes suck. They don't actually, which is a bit of a surprise to me. So what we did was we went out and we measured 1,000 calves. We measured them at 3 different dairy farms and also at a calf rearing facility. And to my surprise, geez, that looks pretty good, doesn't it? So it actually works pretty good. It's a very practical thing when we compare a weigh scale to a weigh tape. Another common concern that we run into with these weigh tapes is that it differs depending on the observer. So what we did for each one of those calves is we had 2 people weigh those animals. And much to my surprise, that's also pretty darn good, isn't it? So almost a straight line. So I think using weigh tapes can be a really practical way that we can evaluate the dosing that we're providing to calves to make sure that we're providing the right dose to these animals. A final consideration and one that we've recently researched is the utility of using colostrum. And maybe Mike covered this morning. Did he, Stephen? No, that's good, because he told me, he threatened me he might. So I'm glad he didn't. So colostrum is one of the things that we've looked to evaluate the therapeutic efficacy of it. You might be thinking, well, why colostrum? These calves, when they get diarrhea, they're 2 weeks of age or older. Why are we doing that? There's actually pretty good evidence in the human literature that bovine colostrum can serve as a way to reduce the severity of diarrhea. So we thought, a while ago when Javi Carter was doing a master's degree, why don't we try this out and see, can we get efficacy in calves? So this is a study that Javi did, also at a calf rearing facility. We enrolled these calves right at the onset of diarrhea. We enrolled them into 3 different groups. They're on their control group, 8 feedings of their regular milk diet. And then we had a combination group that was 50% colostrum replacer, 50% milk replacer that was fed to these calves. We had a short-term colostrum group, which was 4 feedings of this mixture, then back onto milk. And then we had our long-term group, which was our 8 feedings of this mixture back onto milk. These calves also received electrolytes. They also received meloxicam at the onset of diarrhea because we didn't want that influencing our results. We followed these calves for 56 days, and here are some of the results that we found. So overall, we found that calves in that long-term group, so 8 consecutive feedings of that mixture, resolved diarrhea about 2 days sooner. They also gained more weight over the 56-day period, about 100 grams per day more. We didn't find any differences in antibiotic use. We didn't find any statistical differences in mortality. But if you look at it, we had 14% of calves die in the control group and none that died in the long-term colostrum therapy group. So perhaps shedding a little bit of light that we can use alternative therapies for diarrhea beyond our traditional means that we've used in the past. One of the things that I think we're missing in this conversation so far is we really want to make sure that we're identifying disease as early as possible. All these therapies are for naught if we're not identifying them right at the onset of diarrhea. So how do we do that? If I went out and asked producers to go and do fecal consistency scoring, which my grad students do a lot of, probably not going to happen, realistically. So we have to use other metrics, we have to use other means to detect disease in these calves. One of the things that one of my current PhD students, Alison Welk, is working on is looking at drinking behavior and also looking at activity in these animals to see, can we utilize this to flag calves that are at high risk to develop disease? So this is a study that she did at the research station, the Ontario Dairy Research and Innovation Center. And what we did was we looked at calves looking at healthy, those that developed mild diarrhea, which are those that had just diarrhea, no clinical signs of dehydration. And we also looked at calves that had severe diarrhea. So those are calves that had diarrhea with additional clinical signs indicating they're dehydrated. And then we looked at their milk intake from the 3 days prior to 7 days following that bout of diarrhea. So we look at healthy calves, you can see a bit of a flatline trend. It's increasing through time. As the calves get older, they typically drink more milk, so that makes sense. When we looked at mild diarrhea, we found a drop on the day that they developed diarrhea, 1 day following. And then if we looked at those calves that were destined to develop severe diarrhea, they actually dropped about 1 day before they showed any clinical signs of diarrhea, before they really had that abnormal fecal consistency that I spoke about earlier. So if we shift over and we look at the number of steps per day, there are some new technologies that are becoming available that are making it easier for our producers to monitor activity on the calves. So this is a commercially available program that we used on these calves to look at the number of steps and their activity that was taken per day. So we look at healthy calves, again, very similar trend where it's increasing slightly through time. If we look at mild diarrhea, not a big difference. There is a significant difference on day 2 after they showed clinical signs of diarrhea, but not really that major. But if we look at calves that when it were destined to develop severe diarrhea, we found a pretty big drop on the day that they developed diarrhea. So clearly we can use some of this precision technology, whether it's monitoring the steps that they're taking per day, monitoring their milk intake, to hopefully flag calves that are at risk to develop these diseases. And that's exactly what we did, is we created an alarm that was indicating these calves were at high risk to develop disease. The next question with this research is, well, what do we do with this information? Lots of producers have lots of alarms that they have to deal with on a daily basis, from the robot, automated milk feeder, all the different technologies that they're using. So we want to have it some sort of action item for these alarms. So that's what Alison also worked on. We enrolled 88 calves at the Ontario Dairy Research and Innovation Center. These calves were on automated milk feeders, and they triggered an alarm when their drinking speed and also when their milk intake dropped over a 2-day period. What we did when they generated that alarm was we looked at, could we use colostrum in that case? A non-antibiotic alternative, something that most producers have readily available on their farm, to see, does it really make a difference? So our groups were 1 liter of colostrum replacer fed each day for 4 consecutive days, just once per day, and then a milk replacer group, which was balanced on energy, because we didn't want that to be different between the groups. And what we found was some pretty interesting results. So specifically, if we looked at growth, after they were enrolled in the study, so after they generated that alarm, we found that calves that are in the colostrum replacer group gained about 2 kilograms more over that week. By the end of the 3rd week, or the 2nd week, they weighed 3 kilos more. So we found an important difference in terms of body weight gain. We believe that was largely driven by the fact that they consume more milk. So in this graph, we have the amount of milk that they're consuming per day, days after enrollment on the bottom. And overall, calves that were in the colostrum replacer group consumed about 1 liter more of milk over that period. In addition, these calves took more steps per day. They also received fewer treatments. When we looked at meloxicam, they also were less likely to be assisted to the feeder. So the mechanisms for why, it sounds really interesting, I think, hopefully to this audience, that we can use colostrum to these high-risk calves. The reason why is a little bit unknown, to be honest, and something that we need to dig into a little bit more mechanistically to understand what's happening in these animals. It's probably a combination of all the components of colostrum, lactoferrin, oligosaccharides, all those different components that are really helping these calves to respond better or recover better when they have a bout of diarrhea, is what we think. Another thing that Alison explored is also using NSAIDs, like meloxicam, at the onset or when they trigger an alarm. So the exact same breakdown on automated calf feeders, they triggered an alarm when they had a reduction in the amount of milk they're consuming and also a reduction in their drinking speed. The two different groups we enrolled them into was a meloxicam group. So we injected them with meloxicam or we injected them with a saline solution. Exact same parameters we evaluated in this study. What we found in this study was when it came to percent that were treated with electrolytes, we found that those that received meloxicam were much less likely to receive an electrolyte therapy comparatively to those that were in the saline group. So almost double the amount that received electrolytes in the saline group compared to the meloxicam group. When we looked at the number of steps that they took per day, I apologize on this graph, I realize it's a little bit skewed, but those in the meloxicam group took more steps comparatively to those that were in the saline group. We looked at other things like diarrhea duration, it was very similar. We didn't find any differences in feeding behavior, any differences in growth, but perhaps this indicates that the calves that received meloxicam maybe had a reduction in the severity of disease, indicated by less severe dehydration or the number that were treated with electrolytes, but also a reduction in the number, or an increase in the number of steps that they're taking per day. So maybe these calves are just simply recovering a little bit better as a result. So for some takeaway messages from this presentation, hopefully what you understood from it is that diarrhea is really common. It's really the most common disease that we face in our young calves. So 67 to over 80% of calves receive it. It's also quite costly. The average dairy farmer in Canada is losing about $28,000 every year as a result of it. We know that fluid therapy is really the most important thing that we need to provide to calves. Absolutely essential. But what we don't know is really the best electrolyte formulation we provide to these animals to ensure we're not causing harm. Because in a lot of cases, there are some electrolytes that probably are doing that. Anti-inflammatories certainly help these calves to recover better, whether it's at the onset of diarrhea or the onset of our feeder alarm. We certainly found that these calves are able to eat better, they're able to take more steps and maybe have a reduction in severity. We also know that antibiotics are really only needed seldomly in cases of diarrhea. And in fact, if we treated every calf with an antibiotic at the onset of diarrhea, it's going to actually have negative effects on that animal long term. Early detection certainly can change the outcome. So if we look at milk intake, we look at the number of steps or activity that they take in per day, clearly that's going to help us to detect these calves sooner, so hopefully we can have more action. And the final thing I wanted to leave everyone with is that although we talked about treatment here, that's where we spend a bit of time focusing on, prevention is really still critical. We want to prevent these cases from happening, because if we can do that, we really don't need to have conversations about all the stuff we just did. So with that, it's always fun to present to audiences, and I'm lucky enough to present to many different places around the world. But it really is the students that make it happen. I see there's lots of students that are here today. You guys are really the people that make the action here and make Dairy at Guelph really what Dairy at Guelph is. So thank you all for your hard work. Also like to thank all the sponsors of the research that funded the data I presented as well. And with that, I'm happy to take any questions you might have. Thanks for listening.